This is Dr. David Renders speaking, coming from to you with Animus Prime Research Labs. I want to share with you on today, and I have my cell phone here, it's a few notes, but I really want to share with you dealing with patient or client assessments that deals with just intake. Dr. David, what are you talking about with assessments and intake from a healthcare or mental health or just life care, well care standpoint, holistically? What do you mean? Well, when we deal with assessing assessments, we need to deal with this word called probing. Okay, probing. You want to make sure you know all the details. And when I say details, dealing with that patient, dealing with that client, dealing with the welfare, the life of what's going on with them. Okay, I want to share this with you. History, 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 history. A lot of times, knowing their dietary intake, what are they eating? Are there certain medications do they take? What's their age? What's their family history? Has their family history had dealing with anorexia? Has it dealt with mental illness? Has it dealt with different nerve system damage? Is it deal with dementia, mental illnesses? Is there certain things that deal with joint pains or inflammation, or dealing with diarrhea, or is it dealing with various respiratory or aortic problems that deal with the chambers of the heart? Are there certain things with other chambers, the other three chambers of the heart? Are there certain things that really has been chronic pain, whether it be chronic joint pain? Is there certain things dealing with arthritis or tissue damage? Is there certain things just dealing with certain habits and vices dealing with alcoholism? What is the point? Or smoking weed or drugs, or certain conditions that the people might have a propensity to have. A big one is diabetes, type 1 or type 2. What is going on in their world? And you are the investigator that needs to know the healthcare professional, or just that, even I'll put it like this, even certain things dealing with therapy, counseling. You want to know all about them in a good way, not to judge them, but how can we proper service them? Dealing with understanding their day-to-day life. Is it certain things dealing with exercise, health and wellness? What is their regimen and routine? Do they have children? Do certain things have certain things happen to the children dealing with illnesses, or certain things, like I said, metabolically or anatomically, or in their DNA, or certain accidents or scars, or different things on just different notes, okay? So it can get pretty lengthy dealing with the intake assessment. Now, usually what I ask people, I ask that client, I say, hey, on a scale of 1 to 10, 10 being the best, 10 being I'm great, I'm happy, I feel good, doc, to mediocre, I'm okay, I'm so-so, kind of just blah, or 10. Horrible, I'm in deep pain, I'm in anguish, I need immediate attention, I need help fast, I need help now. In a way, we want to, nothing's wrong with pictograph or pictures, so that people can say, hey, that's me, that's what I feel like. I feel horrible, I'm in deep pain. Some of you might have felt like this before. I know I have. Some of you might have felt like this before. Some things going on not only with your health, but dealing with your mind. Hopefully we want everyone to get to this part right here, dealing with feeling great, feeling good, feeling energized. And the thing is, we want to be able to get to wellness or balance. Okay, I want to share this. Dealing with the initial meeting with the client, during with the individual that gathers the info, so that the immediate needs can be, I like this here, to get encouraged within the engagement and retention dealing with the services. Okay, so sometimes people have a hard time filling out intake forms. They might be a little scared, they might be a little nervous. And here's the thing, you want your clients to be able to be comfortable. Any questions that they have, make an attendance, or make it a mindset to answer, involve yourself to answer their questions, and to be able to answer it with gravity, okay? Not to scare them by saying, well, I don't know, you may die, You want to share it in a way that people are understanding of the risks involved with certain things that's going on, dealing with their life or their life decisions, life choices. And we want to be able to share this in a nurturing way, a professional way, much like with the Hippocratic Oath saying, hey, do no harm. We're not going to do any harm, okay? We're not gonna go messing people up, messing up patients, messing up clients. We're not gonna do that. We're gonna bring forth great health and wellness care, and if you will, the L word, dealing with love. Not just labor, but love, okay? So basic forms, we want to write out those notes. I want to share this here. Mental health progression notes. There's templates for healthcare professionals that may not know this. Don't just rely on subjective statements. Go into detail, not too much excessive detail, but detail nonetheless. Detail on what's going on. Know when to include or exclude information, and bring in the client's strength. Don't just be a negative Nancy. Be positive, if you will. Be on the positive end, and give the client, give the patient hope. Save paper, time, and hassle by documenting electronically. Some things you're gonna write it out, give a copy to them, but it always helps electronically in this digital age. This is Dr. David Render with Animus Prime Research Labs. I just want to share this with you, moving great health into the future in a great balance, a great way, with a great dimension. This is Dr. David Render. Until we speak again, thank you.